Welcome back. We're talking about the 3 medications that cause the most adverse drug events, or ADEs, among older adults. Angie Woodmansey is still with us. Welcome back again, Angie.
Thank you.
So we were talking about anticoagulants before the break, and maybe you could mention how a person would know how much of that drug that he or she could take safely.
Well, you know, that is, for warfarin specifically, it is determined by a blood test that you have done. Your doctor will order it. It's called an International Normalized Ratio, or INR. And they'll measure that level, and it tells them if you're at the right dose. They typically look for a range somewhere between 2 and 3, but that can vary depending on your medical situation. And based on how your level comes out, they'll tell you to increase your dose or lower your dose. And that can get kind of complicated because with warfarin, sometimes they might say, okay, I want you to take 5 milligrams on Monday, Wednesday, Friday, and then 2.5 milligrams all the other days of the week. And that can change every week, so that it's complicated. But with the newer novel agents, however, it's much more simple. There might be some initial blood work needed, but then after that, the dose results in a pretty predictable blood level, so they don't have to monitor as frequently.
So how often, for warfarin, for example, would a person have their blood tested?
Well, when you first start it, you would want to get tested at least every 1 to 2 days. And then if you're doing okay, they might bump it up to 7 days. And then finally, once you're stabilized in that proper INR range, then they might have you go 4 weeks or even 6 weeks, depending.
Okay, great. So other than getting regular blood tests, how else can folks who are on anticoagulants help prevent ADEs when they're taking those?
Well, it's really important to follow your instructions exactly. As I said, the regimens can be super complicated, and so you want to write them down. The minute your doctor tells you, you write it down, keep it posted somewhere. And because your dose is always being adjusted, you might have 2 or 3 or even 4 bottles of warfarin at home, all different strengths. And so you will want to always make sure you check the strength before you pick the bottle to make sure you're getting the right dose. And another thing is just, you know, always remember that this can interact with some drugs, particularly aspirin. Aspirin also has some blood thinning properties, so you wouldn't want to combine the two unless you talk to your doctor about that first. And then also diet is a really big thing to keep in mind when you're taking warfarin. Vitamin K, which can be found in green leafy vegetables or things such as spinach or broccoli, can actually interact with warfarin. It can decrease the warfarin's effectiveness. And so what's really important is that you maintain a consistent diet. And so that means you still can have these foods, but you just need to tell whoever's monitoring your warfarin that you're eating it, and just really try to be consistent. Don't like suddenly binge and eat, spinach salad three days in a row if you normally don't.
Okay.
Your doctor can adjust your warfarin around your diet, but it's much easier if you maintain that consistency.
Excellent. So last but not least, let's talk about opioids. What are they, and when are they typically prescribed?
Sure. Opioids are controlled substances, and they are just one type of a pain medication. Some of the more common ones you might have heard of are oxycodone or OxyContin, or hydrocodone-containing products such as Norco or even morphine. And there are many reasons why a healthcare provider might prescribe these. They can be prescribed for like an acute injury or after an operation or surgery. They can be prescribed for certain severe chronic pain situations, chronic back pain or chronic arthritis.
And why are they potentially dangerous? Can you talk about that, Angie?
Yeah, they have a great risk for side effects. So opioids can cause you to have, they can slow down your breathing. And so you might be taking it and your breathing can slow down, your heart rate can slow down. And so therefore, if you take too much of it or you're not responding well to it, it could slow your breathing down to the point where you could stop breathing. It can also cause drowsiness, dizziness, confusion, which can cause problems with your daily life. You can also build up a tolerance to these medications. So you may find that you've been stable on a dose and all of a sudden it's not working for you anymore. So you have to keep creeping that dose up and up and up. And lastly, probably the most important big thing that you hear about in the news is that opioids can be addictive. So that's really important to keep in mind, and they can lead to overdoses.
So if I'm prescribed an opioid, what important questions should I talk to my pharmacist or doctor about?
The first thing you want to ask is, how long do I need to take this opioid? That's super important because I think they're just now realizing that you shouldn't maybe take them as long as they typically thought you should take them for, especially like an acute injury. For an acute injury, really 3 days is probably the most you would need, or even post-surgically, probably no more than 7 days. So you really want to ask about that. And also talk to your doctor about the risk versus the benefits of taking the opioid. You might want to ask, is there a safer alternative that I could take that might help me with my pain just as well? So that's really important. You know, and just talking to your doctor is just the other key piece with all of this.
Absolutely, always. Are there some risk factors that predispose someone more to an opioid ADE?
Sure. If you go to multiple pharmacies, multiple doctors, it's hard for all of them to stay in the loop and know what you're taking, and so they might miss possible drug interactions, and opioids can interact with some meds. So I recommend that you avoid that and try to stick to one pharmacy if you can. Also, if you're taking a high daily dose of opioids, that sets you at a greater risk for adverse drug events. And also, taking it with alcohol is usually not recommended because alcohol can also slow down your breathing, and so it can compound the side effects.
Yes.
And that can also happen with certain prescription drugs such as benzodiazepines, which are alprazolam or Xanax or Valium. Those medications also have a side effect of possibly slowing down your breathing and your heart rate, so could be dangerous taking the two together.
All right, so we've already talked about some general medication safety tips for preventing adverse drug events in general, and we've talked about the big three. Is there anything else that you would want viewers to know when it comes to preventing these types of ADEs?
Oh, sure. I think the big thing to know is that the more you know about your medications and the more you talk to your healthcare providers, the more educated you will be.
Yes.
And the safer you will be with your adverse drug events. So like I've always said, be very proactive. And then lastly, an interesting tidbit is that as we age, we process medications differently. Yes. And so medications that you normally wouldn't have a side effect to, you may find that you're now suddenly having side effects to them. So if suddenly some new symptoms appear, you might want to talk to your doctor about if they could be related to the medications you've been taking.
Great, and I know there's a national focus effort right now on preventing the three big ADEs. Just in a few sentences, could you mention that? You bet. Yes, there is a huge initiative. They're honing in on which medications are more likely to cause problems. They're also honing in on what processes that maybe where there are problems at. Like, for instance, they identified that there could be a problem with how we were writing prescriptions Sure.
and getting them to pharmacies. So they're recommending computerized
Yes.
order entry and computerized transmission to pharmacies, and that's been a huge improvement. And also, if you have hospital pharmacists, they're recommending that hospital pharmacists make sure that they're part of the care team of a patient that's hospitalized, that they do rounds with the doctors, and that they're involved in making decisions on appropriate treatments. Excellent. Thank you so much for your time and expertise today. You're welcome, Lisa. Thank you. You bet. Thank you for tuning in this week. We hope to see you next week again. Until then, stay fit, stay well, and stay healthy for life with Healthy Living for Life.
Healthy Living for Life is brought to you by Mountain Pacific Quality Health. We'd love to hear from you. If you have suggestions for future programs, visit our website at mpqhf.org or call us at 406-443-4020. You can also catch us on YouTube by visiting our website and clicking on the YouTube icon. Special thanks to Fire Tower Coffee House and Roasters. Production facilities provided by Video Express Productions.